Okay. Hi, everyone. Thank you so much for joining us today. I really appreciate your time. I am Roden Monrose. I'm the CEO and founder of CariClub. I started this company because I really wanted to make it as easy as possible for people who wanted to get involved to find it an easy path to getting involved. And so we built a platform. It really makes that entire experience very seamless. Our main focus has been on connecting young professionals to a support. But given the environment we're in right now and feedback that we've gotten from many nonprofits, we've realized that nonprofits are very keen to connect with folks who could help out in a more broader sense beyond the associate board role. And so we are, for example, like nonprofits are looking for remote volunteers, people to help with social media campaigns, for fundraising, and they are still looking for professionals to help in other ways, but we wanted to kind of bring this community together through CariClub and get people involved. So I will leave it to our panelists right now to tell you more about their amazing organizations and how you could make an impact while sheltering in place and staying at home.
Great, thank you for that, Roden. So to get started, just a few housekeeping things is, again, our goal for these weekly webinars is to create an online community where we can be a resource to each other. So as we're talking, please feel free, there's a question tab where you can type in your questions. Please feel free to start asking your questions there. And if you have anything pressing, please feel free to raise your hand so we can note that as the webinar goes on. So like Roden is saying, we wanted to focus on nonprofits, one in our hometown of New York City, but also more importantly, because New York City right now is the epicenter of the pandemic in the United States, and wanted to bring focus to that. So that being said, I wanted to introduce you to our two nonprofit organizations. So we have Diane and Alyssa from New Destiny Housing. Welcome, and Christina Perez from Catholic Charities, Archdiocese of New York. Thank you all for joining. So what we understand and what we're seeing as things change is the harsh reality is a lot of people are affected by this, especially at-risk communities, pardon me, especially at-risk communities. And one of the things that is unfortunately happening is things are really changing by the minute. And no, I don't think anyone, big or small organizations, companies, etc., have the right answer. We're all just trying to be flexible and change with the times as the news comes in and we see this affecting our immediate communities. Diane and Alyssa from New Destiny Housing, can you guys share with us what is happening within your organization with COVID and how, given your community is a very at-risk community, and given what you do, how is your organization impacted by COVID? And how are you guys trying to get ahead of everything at the moment?
Hi, this is Diane. Thank you so much for inviting us. I think my webcam is frozen, so I apologize for that. So I'll talk a little and then I'll pass it over to Alyssa. So I am the Director of Development and Communications at New Destiny Housing. I'm just going to briefly say what we do so people sort of really do understand who we're serving. So New Destiny is a New York City not-for-profit. We were founded in 1994 with the pioneering mission to help domestic violence survivors access long-term security and health through permanent housing. Typically, service providers for domestic violence victims are focused on crisis, getting someone out of a dangerous situation. And in New York City, there is a robust shelter system. So there is a shelter system for survivors, but New Destiny was created to really address the question of, well, what happens after shelter? In New York State, people can only stay 180 days in a domestic violence shelter, which seems like a long time, and it certainly feels like a long time if you are that survivor with children in a shelter. But the reality is that with affordable housing in such short supply, few people actually leave the domestic violence shelter system for a safe, permanent home. What typically happens is they go to a different shelter, just a general population shelter, where they're not going to have any kind of supports and services. They may end up for a while sleeping on someone's couch, you know, moving into their sister's apartment with their 2 small children. That may last for a while. They could couch surf for a while. And sadly, all too often, families end up back with their abusers simply because they have nowhere else to go. So New Destiny was created to address that gap in service provision and to really end the cycle of violence in these families. And up on your screen is just some of the data, which is kind of shocking. You can see on the left how much it costs for New York City to house a family with children in a shelter, and then how much it costs to house a family in a permanent, safe, affordable apartment. So how does New Destiny solve this problem? We build buildings, and our buildings are beautiful. They're permanent, affordable apartments. People have leases. They can stay as long as they need to. And half the apartments are set aside for survivors of violence and their children who were in a homeless shelter or a domestic violence shelter. We provide on-site services that keep the families stable and safe. We also have other programs. One connects survivors to apartments in privately owned buildings, not our buildings. And the goal for that program is to circumvent homelessness or to reduce the time someone spends in a shelter. The screen just disappeared. I don't know if that's the case for everyone. We also have a housing resource center, which provides up-to-date information on all the affordable housing resources in New York City. And then I want to describe our on-site services, which is really sort of the heart of our work. And I will just say that Jody couldn't have said it better. It is shocking how the situation on the ground is changing literally day to day. So the first week of work at home, which I guess began March 15th in New York, we had to quickly pivot to providing remote services for our clients. So we have about over 200 units with to about 230 children in our buildings. The heart of our program are our on-site services. We connect individually with people. We provide on-site activities. We have a beautiful community room. We have a computer room. We have a outside playground for the kids. We unfortunately had to shut that all down for the health and safety of our tenants. You know, social distancing could not include group activities for children or adults, and for the safety and health of our staff. So how do you, the first question we had to really figure out was, honestly, the technology. We weren't set up to provide remote services. That was pretty much resolved within week 1. And then we had to really quickly pivot to, how do you still serve people remotely? How do we continue to create community, which is critical to our work? How do we make sure that our tenants are getting the services they need? So the first couple of weeks was completely focused on technology. Most of our tenants do have some kind of phone, but they have very limited data plans. They may have a single phone for a family of 4. So we had to make sure that we were able to communicate with them. And then for the households with children, which is the majority of our households, we had to make sure that kids were set up to access remote learning. So in New York City, the Department of Education came out with a plan to give Wi-Fi enabled laptops to every child. You know, you can only imagine what a vast undertaking that was. And so our staff were communicating endlessly with our tenants and, advocating on behalf of them to get those laptops. If you're a wealthy family in a good neighborhood, you can figure that out yourself, but our tenants, overwhelmed to say the least with just their daily lives, don't have that. So that was really, really critical. I'd say that within 2 weeks, 90% of all of our tenants' children had the laptops or had figured out some kind of workaround. Some of them do have their own technology. And so that was really a big piece of what we're doing. So now that that's calmer and in place, we're able to focus on other needs. We are very much aware of the mental health challenges of our tenants. Not only are many of them have residual effects from having been victims of domestic violence. That kind of trauma impacts you for years to come, but now they have heightened anxiety around COVID-19, for them and their children. Many of them are working still. They are the frontline workers. They have very low income jobs, which are typically home health aides, possibly a nurse's aide. They work in supermarkets, they work in warehouses, they're security guards. So they are being asked to continue working, and honestly, they're being asked to work without any kind of masks. That's not unusual in New York, and it's scary. It's scary for them personally. They don't want to get their children sick. So we are reaching out every week to every single tenant, however they prefer, to make sure that, to help them manage their anxiety, to see what they need. So Jody, how am I doing for time? I don't want to go on too long.
That's great. And, actually perfect timing to go into a question for Alyssa actually is, like you're saying, Diane, these are the communities that you're dealing with. These are people that are the most vulnerable, the most at risk. And now that everything is moved online, Alyssa, you were telling us yesterday, your junior council now is really spearheading a lot of these campaigns in order to, like Diane is saying, provide these laptops for children, provide aid for the workers that are out on the front lines. Can you just talk quickly about how the junior council is getting ahead of that and how really, you guys are spearheading and supporting the organization as young professionals?
Yeah, of course. Similar to Diane, I'll try to mimic her structure in explaining what the Junior Council is and how it is in connection to New Destiny Housing, what we've done, so you can understand what the council has done and what its causes are for, and then move into your question. So my name is Alyssa. I work for Allianz Global Investors. I'm our CEO's business manager. Right now for New Destiny, I am the Junior Council Vice President. I've been with New Destiny for over 5 years now, and I've held a numerous of roles. As part of the Junior Council, we help bring awareness to the greater cause of New Destiny Housing with regards to hands-on volunteer work. We do work directly with the tenants in the community in New Destiny Housing. As Diane mentioned before, New Destiny Housing provides permanent affordable housing. So they have apartment buildings spread across between Brooklyn, Queens, and the Bronx. And the GCE members will interact with the tenants of the community of those buildings. We host 3 times a year a holiday-themed tenant event, a Halloween event, a Valentine's Day event, and a Mother's Day event. As volunteers, we plan out afternoon-filled arts and craft activities for the children, as well as interactive sessions with the mothers. In the past, for example, we've done Dress for Success, resume building, and interview prepping with the moms. These events are funded by the Junior Council. We plan and pay for all the events, as well as provide food. We help fund these initiatives with 2 fundraisers that we host ourselves. We have an ugly sweater party in the winter, as well as a summer rooftop event. In addition to the tenant events, we also help contribute to New Destiny with our annual Back to School drive, and that is an initiative we do purely online. We set up an online account. We organize with the buildings to send the supplies directly to them. So we'll set up something with either Target or Amazon, and our network would go in and send their donations through supplies for the children to go back to school. We do rely heavily on the building staff for those initiatives. So It's really why we tend to only have one of those a year. And then the last thing that we do as a junior council is we do organize a cocktails for our cause, where we can try to expand our own membership and our board and bring awareness to our council. We try to continue to work within our own network, as well as the following we have established as a board. And then lastly, I guess to address the questions that Jody had mentioned, and around the whole current environment and pretty much the difficult times everyone is facing. Unfortunately, we did have to cancel all of our events for spring and summer, mainly because, as I mentioned, our efforts are relied heavily on physical interactions with the tenants. So we've shifted our efforts to pushing more on social media and our brand presence. We are working with the Destiny Board in ways we can help support the initiatives that they currently have in terms of raising awareness, both what activities they plan on doing and initiatives we plan on doing, as well as raising donations. We are exploring initiatives where we can raise virtual gift cards, where we can send directly to the tenants and they can use within their local areas, both in the Bronx and Brooklyn area. And then that's really and truly all that we can offer. Obviously, we are quite limited at this time, but I do want to emphasize that doesn't mean we're not welcoming volunteers into the program or in joining our board. I mean, any means that we can bring awareness and grow what it is we do for the organization and help bring donations and attention to this cause. And once we resume normalities, we can always go back and use these volunteers as fresh eyes and mindset that they can bring to the table and what we do.
Thank you for that, Alyssa. And a lot of, like you're saying, whenever we do go back to whatever that new normal is, I mean, all these events that you talked about are great in just bringing that awareness. And I know you yourself you've been to a few of our own CariClub events. And we definitely look forward to working with you down the road with that and, spreading the news on how people can join and attend that down the road. But right now, I know your website has a lot of information as well, and we'll send that out to our members to, like you're saying, how they can help with Bureau volunteer programs and social donations and help with social media campaigns and so on. I want to make sure that we also give Christina enough time as well to talk about Catholic Charities before we get into the Q&A. Christina, thank you again for joining us. And if you could also speak on how your organization has been impacted by COVID. You guys, I mean, you've been around since 1917, which is over 100 years of serving New Yorkers, which is incredible. And you cast such a wide net into the different communities. I know from everything children and youth to immigration and refugees. And so you have a very different perspective, I'm sure, on how this is affecting everyone in New York. Can you share with us how the organization is dealing with COVID-19?
So here at Catholic Charities, as you said, we do cast a very wide net. As you guys can see below, we have about 5 main buckets, and we have about 90 agencies in total. So due to COVID-19, we are currently reassessing and keeping our programs alive in order to still support the community. People still need food, people still need housing, they still have immigration still needs to run to be able to do legal efforts. So everyone in Catholic Charities has been really working as a community together to reassess which ways to keep our clients safe and also to keep the community safe alongside with our volunteers and our staff. So for the volunteer perspective, we have plenty of stories where for example, a meal delivery, instead of a senior receiving a meal every single day, we changed it now to being once a week, and they will receive all 7 meals, including some fresh frozen meals as well. So it's really been a massive effort of just really communication and people working together to make sure that people still receive those services. Another great thing too is our junior board is also leading the efforts in ways with their connections within the agencies. Something that's quite unique about our junior board is because they work with 90 agencies, they're able to do be exposed and work with so many different types of people. So one good example was with Vista on Fifth. It's a senior residence home, and the junior board 4 times a year throws a volunteer party for them. And they do a theme, and the seniors get to dance and sing and all that stuff. And in light of COVID-19, the seniors are right now being told to be sheltered in place. So the junior board gathered together to create a pen pal program with the same seniors that they volunteer with year round. Other things that the junior board does are food deliveries. They also do midnight runs for feeding the homeless. They've worked in Incarnation Children's Center with children with HIV and AIDS, and they have done game nights with them and tutoring with them. So the junior board really has grown and expanded through those connections that they have interpersonally with the staff at our agencies to still connect and make sure that those individuals are supported.
Thank you for that. And so as the junior board is really spearheading some of these programs, are there ways right now immediately that people can maybe help volunteer virtually, or maybe it's just bringing on new people for a fresh set of eyes, a fresh set of mindset to help kind of get ahead of the pandemic as it changes by the minute? Can you share with some ways that are available?
Yes, absolutely. So right now on our website, we have a volunteer page, fully managed, and we actually are looking for several things. So we have pen pals for seniors throughout New York City that are quarantined. We have a large mass network of social workers who are connected directly to families who are also being quarantined because someone has COVID-19. So we are also looking for donations in that sense. Other remote volunteer opportunities include connecting with parishes and pastors to help them go virtually online to do mass and Bible sermons and things like that so they can still connect to their congregation. We are also working right now on doing tutoring and financial budget classes to be online, so that will be a new opportunity posted up soon in the next coming weeks. We are also looking for grant writers and social media developers for one of our agencies. It's known as Maria Drost, and they are specifically for mental health counseling, and they're looking for people to remotely be able to create campaigns, because in this circumstance, mental health doesn't just disappear, it doesn't go away, and there's a lot of stigmas about it. So their social media developer is critical in order to really address those needs, to change the public perspective of it, and to mobilize individuals to be able to help and to step in public settings when a need arises. So there's a lot of opportunities that exist right now virtually as well as in person, but the needs just continue to grow and change. This is something that we're, once again, constantly adjusting and growing to because of all the communication.
Right. And one of the things that you and I were talking about yesterday was I had asked you about, are there any specific programs that deals directly with people of color or those at-risk communities? And I know you don't have the data on that, but can you speak, and this also applies to Alyssa and Diane, you guys too, do you, just within New York, are there specific boroughs and communities that you're really seeing that's really hard hit? I know it's very easy to Google or just watch the news, turn on the TV, listen to, whatever news outlet that you're referring to, but we have the comforts of working from home and sheltering in place. I'm sure there are a lot of statistics that we don't see, or a lot of information that we're still not yet privy to. Can you share some outlook on that?
Yes, absolutely. So regardless of anything that's happened within the pandemic, we still have a lot of day laborers who are still looking for work, and right now they can't apply for things such as on anything governmental. So there are full programs in place to try to make sure that they don't lose their homes, they still receive food and housing. We also are right now in the midst of really expanding our food programs itself, especially for children from these vulnerable families. The junior boards has 3 goals, and one of the main goals is to support something called the Saint Nick Project, where we take the most vulnerable families in those 5 categories that you see below. And we provide them year-round educational support, family services, and food services. And then during Christmas time, they get a Christmas present. So those individual families, we obviously have a list of, and they are right now being the most impacted. So we are fully aware and trying to support them as much as possible. Now, where Catholic Charities is located, we have 90 agencies spread out through some of the lowest income communities. So we're talking about Harlem, Washington Heights, the Bronx. Like, it's just, we're everywhere where there's a need. If there's a need, we are there. So this is something that is affecting so many vulnerable individuals in a various way, and it's really, I would say, in a lot of ways, become something where we are now seeing more intricate movement between those categories. Someone who suffers for food services also may now need childcare services. So now we need to be able to provide them with a place for their child to stay while they're going off to Lowe's, like to work at. So there's a lot of things right now where we're doing more communication with connecting clientele.
Gotcha. Thank you for that. And Alyssa, Diane, do you have any input on that front?
Yeah, I can sort of add to that similar situation. I mean, there is actually some interesting data in terms of movement and transit use in New York City, and you can, from that data and the maps, see that though high income areas, people have pretty much shut down and really aren't moving very far. In low income neighborhoods that we serve and that Catholic Charities serve, that really isn't the case, because these are the frontline workers. They live in the outer boroughs, live in the more marginalized neighborhoods, and they're still getting on the subway every day and going to work. And that's actually, I think, might have thought that more of our tenants would have been laid off, but the reality is they're being asked to show up at work because they are working in all those critical services, and they're scared. So, as I mentioned before, a lot of what we are helping them work through is how do you manage that anxiety? And again, all of the people we serve are low income or extremely low income. Because we've been supporting them since they moved into our buildings, they are well connected to benefits. But this is a new anxiety for them, and it may, because they are survivors of violence, have pre-existing anxieties. So it's an incredibly vulnerable population. And we're learning as we go along. And I agree with Christina. It's like, we know what they were experiencing this past week. We actually don't know what next week will look like. And if this is another month, we don't know what week 3 will look like. We can anticipate more people will lose their jobs, or, the stress of managing their children all day long may, have repercussions for the entire family. So, our staff has been amazing in pivoting and addressing the challenges as they come up, and weekly contact is critical. We are very client-centered, so we don't ever, services aren't a precondition to being in our buildings. But at this moment in time, we're being more proactive. We don't want anyone to be lost. We've been, we have an older man who lives by himself. His visits from his niece was his only contact, and that disappeared. So he's incredibly grateful to have somebody just call him up. Our staff helped him transfer a prescription so it could be delivered to his house. So it's, little things like that are really just making a huge difference. But we do anticipate that if this goes on much longer, the challenges will just be bigger and different, and we're ready to pivot and deal with whatever comes up.
And I think I can add on to both what Christina and Diane said in terms of like areas that we're seeing being hurt, especially within the low income areas of outside of critical needed jobs where they need to attend, there's the areas where they've lost their jobs, whether it's like restaurant areas or retail services areas, and they just don't have any income coming in at all. So that's also a little difficult for those people as well. I know Diane and I were mentioning this week about the senior board is looking into putting together a emergency fund, and that's why we emphasize more on why donations are needed more now than we did before for these low income areas where tenants and people are struggling in those areas for these reasons.
Great, thank you for that. And one of the things I think, at least just from what I myself is learning, is like, okay, how can I also help spread the word? I know you both have very active junior council, junior board, Instagrams, Twitter, LinkedIn, social media pages, but can you send me, and we're happy to share that, and we'll share that as well along with this recording to our community, is if you have any posts that we can share within our networks, personal and professional, please let us know. I know it's also on your pages, but sometimes it's just easier to send the direct link as well.
Yes, of course.
Yeah. And then one of the last questions that is coming through is, hold on, I'm just reading it. So with the donations and everything, and programs that we can look into, just want to reconfirm that this is all on your site. And of course, we're showing your email addresses and contact info, phone numbers. Can people reach out to you directly and kind of get connected that way as well?
Yes, of course.
Yep.
Yes.
Our tenant emergency fund information isn't on our website yet, hoping to have that done next week. But yeah, all the contact information is there.
Wonderful. Well, thank you again very much. It is not lost on us that we are all shelter in place, but we all luckily enough have jobs, and we're taking time as well out of our day, and hopefully something will come out of this, and there's a silver lining down the road. But right now, at least, the silver lining is we have great organizations like yours out on the front lines trying to provide some sort of comfort, even if it's just a little bit, to your communities. And hopefully CariClub members can also help with that. And again, we are doing these webinars weekly to bring to light of all the nonprofits that are on the front lines. And we'll also send out a recording of this specific webinar tomorrow as a follow-up. And if you guys have any questions, please feel free to email me. And you also have the contact info of Diane, Alyssa, and Christina as well. And thank you very much. Again, really, really appreciate it.
Thank